So lastly, I just wanted to touch on my role. Now, my role exists not only at the Wesley, but in many hospitals. It exists for patients who are inpatients and outpatients at different hospitals. My particular role is looking after inpatients at the Wesley. Now, the goals of, or when we look at my role, I'm there to make sure that anybody who comes in with a cancer diagnosis has everything that they need while they're in hospital. So all the support services, everything we can do to support them, ensure that they have it in a timely manner. But it's also to ensure that when they go home, or we transition to closer to home, that they have everything that they could possibly need, so that they go home feeling comfortable and that the family feels supported. So I identify patients' needs. Now this can be vast and varying, everybody's individual. So whether it be accommodation, and I work very closely with the Leukemia Foundation to let them know when patients have come to Brisbane from far away and they don't have anywhere to stay while they're here. And we're very blessed to have the Leukemia Foundation help us with our patients. It could be financial, and we've spoken about how the financial stress of a diagnosis can impact on a family. And so we have financial counsellors, which many hospitals do have. We can always refer to the Leukemia Foundation for financial counselling as well, and financial support. And spiritual. We have a team of wonderful pastoral care and nurse counsellors that we can refer our patients to help support them throughout their journey. I ensure that there's a prompt referral made. I liaise constantly with the multidisciplinary team to make sure that referrals are actually being carried through. And then I help to coordinate care. So I'm aware of the patients who are in hospital and their treatment. I'm aware of the patients who are about to come back in. I ensure adequate referrals for discharge. So this might be somebody going home that just needs a little bit of extra support while they're at home, say with showering. So it could be bringing the blue nurses in. It could be somebody coming in as an occupational therapist to look at the home and say, okay, well, we need bars and we need over the toilet chairs and shower chairs to make this safe for the patient who's now going home, who can't manage without these things. So we ensure that the patient goes home with everything that they need. The goal is to improve the journey for those diagnosed with cancer, but not just them, but also their families. And that's why when I walk into a room and I ask the patient what their needs are, I also turn to their families and offer that same support to them. We assess, manage and evaluate clinical and supportive needs. We provide a holistic approach and we ensure a smooth transition from hospital to home. So how can I help patients? By providing education and information. And it may be that I go in and see a family who just don't understand what's happening at the moment, what the next treatment options are and where to from here. So I can liaise with the doctor and come back and share that information and help to sort out a plan for the family. I assist in scheduling of tests and services, timely referrals to healthcare team, advise community support systems and ensure the patient involvement is in decision making, and that's a really big part of my role, is to make sure that patients have the information to help make a guided decision on where they want to go with their treatment, and then liaise with doctors. Now, I just wanted to end with this, just as a little reminder. It's so little, I'm sorry. It says, my heart is twittering, my stomach feels bloggish, and I make a googling sound when I breathe. And the other person says, stay off the internet and come back in a week. The internet can be your best friend. It can also be your worst enemy. And so make sure when you are looking up information for yourself that you talk to healthcare professionals and they guide you where to find out the information. There are wonderful sites such as the Myeloma Foundation of Australia, the Leukemia Foundation, the Cancer Council. Make sure that the sites you're looking at are reputable, they're up to date and you're getting the right information. So please always liaise with your healthcare team so they can guide you towards the appropriate information. Thank you very much.